Mark here with Natural Health. Hey, it's our patient education workshop evening here at 6 o'clock on Monday nights. We have the chiropractic one tonight. We're talking about how chiropractic can help your health, and having a lot of good information to go over. Our schedule is that normally we'll do the nutrition education workshop on the first and third Monday, and chiropractic on the second and fourth. So there's always a way of learning more information if you come to any of our or all of our education workshops here on Monday nights. Just as a quick introduction, my name is Dr. Mark Hochschlag. I've been in practice for 37 years doing chiropractic and nutrition. The chiropractic technique that we use is called Activator Adjusting. If you watched our last patient education workshop, talked quite a bit about that, kind of had a demonstration. That would be on YouTube too. You can go back and look at that. So Activator is a real light force type way of adjusting. So we've done that the whole 37 years. And we do some other techniques too that learned at Palmer College of Chiropractic. So a lot of good things there. So just to a little more history of myself, where as a farm boy, I did a lot of lifting and twisting and bending on the farm, working on hogs and things. So I was at the chiropractor's office a lot, dealing with pain and things, from getting banged around from the cattle and hogs and things, and lifting. So, even as I started back in those days, we looked at chiropractic as helping pain. It was always a good pain reliever, neck and back pain. But as I got older and I started looking at, more of how the body works, really discovered that chiropractic can do a lot more than that. We'll talk about that in just a minute. We raised 4 boys, 3 of which, all 4 of them were in football, and 3 went to college football. So we dealt with a lot of injuries, banging around, and the information too that we learned with chiropractic helping the athletes. So a lot of athletes and even pro football teams, other football teams, had chiropractors on staff to keep their nervous systems working right so they can have optimum performance. And so we learned that as we were going through all the developing years over time. And of course, we combined that with our nutritional work that we did, which the two work very well hand in hand. And now in our office, we have the ability to have some emotional energy work going on too. We'll talk about that in other videos coming up. So going into our topic for tonight, there's a handout that will be on your comment section. It's you want to understand chiropractic, 7 principles to understanding chiropractic, and we'll go through those one by one and try to explain those a little bit. So the first one here, your body is under the control of the brain and nervous system as long as you are alive. So the nervous system controls all the functions of the body. And so that's how chiropractors can influence this by keeping the normal nerve flow working from the brain to the body, above, down, inside, out. So it's a whole different paradigm of looking at how the body can heal itself. The body's meant to be healthy. So in mainstream medical work, they're doing a great job of looking at, if you have a bad problem, you're bleeding, you got to fix that problem. You're having a heart attack, yeah, you got to stop that right then. But let's look at the whole body and find out what's behind all that. Let's look at this more as a holistic approach. That's where chiropractic shines. The other side of chiropractic is too, we don't want to be medical doctors. Medical doctors have their thing. They do great at that. That's what they want to do. Great. Chiropractors like to do what they want. We like to do, looking at the body as a whole, looking at the body as having the ability to heal itself, and through the chiropractic adjustment, which we'll talk about more, unleashing that nerve flow, that energy flow to the body, so that it can heal itself. And that's what the body is meant to do. Now, the reason the nutrition works so well with that is there's a limit limit of matter there. If the body doesn't have the ability to heal itself because of a lack of nutrition, well, you can get all the good normal nerve flow you want, but you've got to have the matter there for the body to be able to heal itself. That's why nutrition works so well with chiropractic. And the thing is that over the years, the last 100 years, as the nutritional diet has gotten worse, with the introduction of all these sugars and sodas and desserts and all this stuff, that's why chiropractic too, when it first started, was able to have miracles, like even with polio and all kind of things. But as the nutritional base got lower in people, those miracles weren't as easy to happen. And then we could still work on pain, but that's not where we really shine. The second principle here is your brain is protected by the skull, and your spinal cord is protected by the spinal column. So that's just, again, they're kind of axioms, they're truths. So the spinal cord being protected by the spinal column, 24 movable segments there with 6 joints on each one. So a lot of moving parts in there. And I'll explain that here too in a little bit when we get past this handout. The next one here, your spinal bones move out of normal alignment and interrupt your normal nerve flow. So the spinal bones are held in place by ligaments, and they move by muscles that are attached there. And these muscles actually too are innervated by the nerves that come from the spine too. So a lot of information has to pass through the body to even to be able to move, bend over, pick up a pencil. You can imagine all the things, all the muscles, ligaments, and things that have to go on there for the body to be able to do that. And the brain, basically the cerebellum, the motor control part of the brain, is controlling all that. So if you're not getting good nerve control from the brain into the spine, you mean even motion is wrong. And then you start to have motion problems. That's where the pain and agonies come from there. But as I'll talk about here in a little bit later, these nerves control the organs and basically all the cells of the body. So, the pain fibers, we can sense those. We know that there's pain there. But when the heart's not working right, we don't really know that that's there. It's kind of a silent problem. And so pain is always a good indicator, kind of like the light on your dashboard of your car. If that's blinking, that tells you something's going on. You need to find out the cause. Now, if you take pain relievers, even good old aspirin and those kind of things, that's like putting tape on the light on the dashboard of your car and kind of covering up. Well, it's not showing up right now because there's tape on it, but the problem is still there. And so what happens is then later, as these pain relievers, keep the tape on the light, eventually the motor blows up. Some big problem happens and people go, oh my gosh, how did that happen? Well, it's because these problems have been there for so long, the body just wore out, had enough, just couldn't handle it, whatever. So again, chiropractic can help to keep that normal nerve flow working good, and then combining nutrition and even the energy work that we do to help remove barriers of emotions and things really helps to keep the body truly, truly healthy. The next one, the disruption of normal nerve flow, is referred to as a vertebral subluxation. Now, that's basically a term that chiropractors use to indicate the 4 parts of a problem. So the 4 parts is basically that the bone is misaligned, and again, that has to happen because the ligaments have been stretched or sprained or damaged, and then the nerve is impinged upon, and the muscle is spasmed. And basically, the muscles are spasmed on purpose to stabilize that area so that doesn't get damaged more, cut more, bruised more, whatever that bone is doing there to that nerve, however it's impinging it. So real important to realize that the body has a wisdom there of spasming those muscles up so that you don't damage the nerve, the soft tissue that goes in between the hard bony tissues there. It is vital to know that subluxations can be silent, causing problems long before symptoms occur. So again, this pain, this symptom, a lot of times the symptoms are the last things to show up. The problems may have been there for a long time, and then finally you have pain, and the body finally says that I can't handle it. We got to get something to go here. The light on the dashboard flashes. Got a problem before the motor blows up. So again, these problems that may have been there for a long time, which in our office we try to get patients on wellness care where they're coming in once in a while to make sure that there's no big problems that end up with the disease process of some sort. Chiropractors find subluxations, and by performing a spinal adjustment, facilitate a return of normal nerve supply. So the idea there again, with all these 24 segments, with all these 6 joint vertebrae, all these moving parts that can go awry, then when that can again get stuck out of place, and eventually it inflames to the point you start to lose motion there in the whole motor unit, or the disc, the vertebra above and below, and where that joint is at, and that nerve gets impinged. We have to get that reset back in place, get that normal nerve supply to happen again. And again, wherever that nerve goes to, whether it goes to the muscle for the cause of the spasm, whether it's a pain fiber nerve, whether it's a nerve that goes to an organ, controlling an organ, how it functions, a hormonal gland, whatever is going on there. That's how, again, the chiropractor can influence the whole body. And normal nerve supply results in a greater expression of life for you. Again, allowing our energy of the brain, the cerebellum, and the rest of the brain to down through the spinal cord, above, down, inside out, getting that energy that the brain is just a big energy producing organ, as well as all the other things it does. But controlling this energy and getting it onto the pathways, which are the spinal nerves that run through the spine and into the organs and glands and things. So that gives you some good basic principles of understanding how chiropractic works. Really important to understand how that helps the whole body. So just a quick explanation of what I talked about there. Our little spinal model here, you can see the top vertebra here is the normal vertebra, and with the normal disc. And so what that means is these joints back here are working correctly so you can get normal motion in the body, and the body can keep nutrients into this disc so that it stays hydrated, nice and thick there. So if one of these vertebrae starts to have a problem, one of these joints gets a problem, it becomes subluxated, misaligned, dislocated, whatever word you want to use. The chiropractic term again is subluxation, indicating the bone, the nerve, the muscle, and the ligament. But that stops the motion there, and the disc starts to dehydrate, starts to flatten, and you get bulging in that disc. And then that can get on that nerve back there, the bulging can, or the inflammation of the joint area, or just the misalignment of the whole bone areas there, the vertebrae themselves. And again, since this is bone, hard tissue, and this is very soft tissue, the nerve, the body has a tendency to spasm these areas up, the muscles that run along the spine, and that's why people go into this real bad spasm, they can't really breathe, because everything is tightened up so you don't damage that nerve. That's the idea. And again, if you let it go long enough, and you get calcium in here, that calcium gets on that nerve, and again, if it's bad enough, and it irritates that nerve to the point that it damages the nerve, then people start to have a lot of neurologic issues, like drop foot. They don't pick their foot up, or their arms are tingly, or all these kind of things that go along with nerve impingement, as well as other organ problems too. So the ideal for us as chiropractors is to get this normal motion back in these areas so that you can get the disc to start to heal. The body is meant to be well. If it has the chance to do it, it will do it. But the problem is, especially in our society, we went from, man has went from a society of walking all the time, running, for thousands of years, and now we're riding in cars all the time, banging around, we're stressed out all the time, we're not in fresh air. It's just all kind of reasons why we have subluxations. And so there's a primary subluxation and a secondary. To quickly explain that, if you fall off, the ladder when you're painting and hurt the spine and cause one of these subluxations, that's a primary subluxation. But if you, have a job where you're on the computer all the time and you're looking down all the time, and then you have cold air comes across here and that pulls it out of place, it gets stuck, that's more of a secondary type of subluxation. Or if you have you eat some kind of bad chemical or something that makes a muscle spasm and pulls it out of place, that's the secondary. Or again, you're not getting enough vitamin C and the ligaments start to get weak and it falls out of place, that's a secondary. But whatever it is, you get it back in place and get these vertebrae working correctly so the pressure comes off the nerves and you get normal nerve supply. So with that, we'll just kind of go into our basic education workshop part of our presentation, where the triangle here is basically it's kind of a microcosm of the human body. And on the three corners here, we have loss of function and pain, we have disease, and then we have nerve interference. So the idea there on a three equal lateral triangle, as one corner gets bigger, the other corners get bigger. So again, as we have more nerve interference, we have more loss of function, and pain, and we have more dis-ease. Now, it's a little different than the medical version of disease, where you have an infection, that kind of stuff. But dis-ease is where the body is just not working right, or just not able to work correctly. So the idea for us is to get this normal nerve supply to happen so the body can heal itself. The body's meant to be well, and it can do it. It just needs some help sometimes. Again, from our whatever we do and banging around and things like that. So if you ever come to one of our patient education workshops or come here to the office too, we have some handouts people can have. This one is about the new patient, and it goes into more explanation about the discs and things. And there's a real good little poster here that looks at how we can influence all the organs of the body, again, with the nerves from the spine. So that's a really good informational brochure to look through. And then we also have more information on activator adjusting. Activator, again, is being a real light force type of adjusting technique. People sometimes are scared of the pop and crack things. And again, most MDs, they know very little about how chiropractic works. All they heard is from patients who may have went to a certain person that didn't work out right, and they got a crack. Or I've even had patients from MDs who are trying to adjust patients and popping and cracking things. They learned it at a weekend seminar or something and hurt the patient. So again, there's ways of helping people, ways of adjusting patients that are very light force, very easy to do, and just helps the patient without any harm. The pain is the tip of the iceberg. Again, this is going back to the our thought process of pain or symptoms are the last things to show up, but usually the first things to go. So we have patients come in wanting to get rid of their pain. Most people are driven to a doctor because of pain. So pain is something we want to look at, but we also again want to look at underlying issues. What's going on below there? What's going on with the discs and the vertebra and the nerve, the ligaments that hold these in place, the muscle spasm, all that. We're wanting to look at what's going on there, and even beyond that, many times we're looking at what's nutritionally needed to help these ligaments to strengthen up, and what's needed to help the muscles to be able to relax, and for the nerves to heal themselves. And even beyond that, some of these emotional problems people have are like a negative feedback loop. Every time they get mad, one of these vertebrae go out of place, and their heart acts up. It's an interesting thing there. So there's an emotional tie and a learned response too that sometimes has to be handled. We'll go into our next board here, where again, how do we as chiropractors in our office take care of these problems, these subluxations? And again, we've talked about activators some already. Where activators is just a real light force way of adjusting. It's a very simple way of adjusting to put the vertebra back in place. Again, taking pressure off the nerves, very necessary. Diversified is a little bit different type of adjusting. Some of the osseous types of adjusting, we know how to do it, but usually activated works very well. We know how to do that. And we're Palmer grads here. Dr. Chip and I are Palmer grads. So that's a local college in Davenport, Iowa, the Fountainhead, where chiropractic all started. And then when we're doing the activator protocols, we're designing the treatment protocol for exactly what that person's problems are. So we're adjusting just what that person needs, not anything else, and only what that person needs. So it's just a very personalized way of adjusting and monitoring how they're doing over time. So a couple more handouts to go over. Phases of healing. Again, we're looking at relief. Most people, again, are motivated by pain, looking at relief, but we also want to look at the regeneration phases and remodeling, where we're trying to get the body then to hold itself back into place, get the ligaments to heal up, because the disc is just a big ligament. So trying to get that ligament to heal over time, get the paraspinal ligaments to strengthen, to hold that back in place. They work like a hinge on a door. And if the hinges are working correctly, the door works right. But if one of the hinges get loose, then things don't work right, and that gets into the subluxation problem. And then the remodeling phase, trying to get all this to heal up and the inflammation back out of the whole thing. So a lot of times people think that inflammation is a bad thing. Well, inflammation is they're put there by the body on purpose to heal the area. The problem is if there's not nutrition there, no way for the body to heal itself, or you just keep banging the same thing all the time, the inflammation just stays there. And then people use anti-inflammatory things like ibuprofen or that. Yeah, it helps with the pain, but again, putting tape on the dashboard light, over time it just gets worse and worse and worse. So then you have the ruptured disc or whatever else goes on there. We even have some exercises we recommend for patients to do. They're just stretching exercises. We get into a lot of different therapies that we do when patients come in and kind of can tailor that to that patient's needs. And our last board here, and this is something that people, again, don't think about when they go to chiropractors, but that we're working on the overall health of the body. Not only the pain, which again is usually the motivator for patients, but the overall health. So if we can influence the nerves that go to the organs and to the glands, again, somehow directly or indirectly affecting every cell in the body, you can have an overall health promotion type treatment. So, and again, looking at, in our case, with our activator adjusting leg length difference, it tells us how that is working, how the body's coming along. Again, that's all explained when patients come into the office. And again, we're using activator adjusting, which is very safe. It's a very painless way of adjusting. It's a real easy way of doing that. So we'll have more information on that later, or you can always come in and we'll go over it with you, or look at our last, 2 weeks ago, patient education workshop on YouTube, which we want to go over a lot more information about activator adjusting. So a few more handouts. We have the spinal nerve function chart. Again, this just looks at the spinal nerve areas, the area of innervation, what area they're coming from and what organs they're going to, and then possible symptoms. So, I mean, a lot of symptoms people don't think about, but like, lung congestion, asthma, heart conditions, liver conditions. There's even, I mean, we've seen the research where people have had heart attacks, died of heart attacks, which, everybody kind of thinks is cholesterol, but no, there was no cholesterol at all. But the person's going to have really bad problems in the upper back, lower neck area. The nerve gets so bad, the body goes into spasm in the heart, can cause a heart attack. I mean, again, this is kind of the ultimate, but the ultimate bad. But that's what can happen. These nerves control these areas, and so that's how chiropractic can help in a whole overall health picture by helping keep these organs working correctly. And then this is another spinal chart too, which has similar things, but then on this side, there's nutrition that we know of that goes along with helping these organs and these ligaments to heal, so we can get this all to stay in place. We do a lot of nutrition, and we know there's special nutritions that we know that work just on the chiropractic side, on the ligaments, the muscles, helping bone to strengthen, helping nerves to heal. We know how to do that, but we also have our nutrition response testing technique, which helps to get the nutrition to help the whole body. So keep that in mind as well. And then we do have our patient education workshop screening forms. So if you come to one of these, or if you use the word spine when you come into the office, we'll do a free initial chiropractic screening to see how we can help. There's no cost to it. So if you come in, we'll just do the initial screening. Or if you just want to have a consultation, we can talk to patients about what their problems are, what questions they might ask. If you have any questions too, you can also put that in our comment section on Facebook there, and we'll get back to you with answers on that. Also, we definitely appreciate a thumbs up, a like. Also like our office if you can. Come back and view this will be taped and put on YouTube, so you can come back and watch it then again too. And again, or just give the office a call. Our phone number is 217-228-2040. So we're always happy to help patients. Again, being around for 37 years, I've seen a lot of people come and go, and I get to the point where I've seen so many people who didn't have chiropractic help, who didn't get nutritional work, in the nursing homes, in all kind of rehabilitative care, but not doing well, and of course passed away with different disease processes. And there's so much you can do to help the body to stay healthy. The body is meant to be well. All you have to do is help it out a little bit. And that's what chiropractic and nutrition and emotional work does is work on the body's ability to heal itself, where the healthcare in this country right now is more on a disease management type of a deal. It's not really healthcare, it's disease management. So, I mean, again, the insurance pays for it, I know, and that kind of thing. But is that really what matters? I mean, how much is your health worth? Don't you want to, go through life with vitality and strength and energy rather than just being pain-free and on all kind of medications and things? So, just a different way of thinking of things, and we're always here to help with that. So, with that, I think we'll end for this evening. Again, don't forget that word spine, S-P-I-N-E. If you want to come in and get a free initial screen, this is what we can do for you. And again, any questions, like us on Facebook, Instagram, and just shoot us a little comment if you have any. I'd love to answer any questions. I think that's it for the night. Have a great one. We'll see you next week. Again, we're ready to have some more fun. So we just want to help you guys be healthy. Have a great one. Thanks.